I'm Dr. Rohrich from Dallas, Texas, Rohrich Knows Podcast, helping you become a better and more informed you. Well, we're continuing this series on finances in aesthetics, plastic surgery, spas, and back with us is Jessica Nunn. Welcome, Jessica.
Thank you. Thank you.
That's good. She's the founder of Maven Financial Partners, and she's an amazing individual that really has helped our practice and so many others really point them in the right direction and allow them to grow and prosper. So today, please go to my Rohrich Knows podcast, and we invite you to see Jessica on several other podcasts that we've talked about on pitfalls and what numbers to look for and how to really analyze your practice. So today we're going to talk about compensation models and what to do and what not to do. So tell us about that. I mean, I think it's a really important thing because we're so wrapped up in our practice and what we do, but we really need to be able to compensate people that work with us and for us so that you can keep moving upward.
Yeah, this is one of the hottest topics that we're seeing these days in our business. So, we work with practices to understand their financials, and one of the biggest, if not the biggest cost in a practice is what? Payroll. Right? Sure. So if you're doing it wrong, it can drain you. If you're doing it wrong, it's going to keep you from being profitable. So we just spend so much time on payroll. And, usually we're not seeing your payroll is too high because you have too many people. Like, it's hard to find people. No one has too many people right now. It's just not something that usually is the problem.
Except the U.S. government. Except for the U.S. government.
Usually we're paying people too much or paying them a fair salary, but they're not generating enough revenue to support their own salary. Yep. So, and those are hard conversations because it's very tough to change someone's compensation model. So obviously it's easier to do it on the get-go right as you're hiring them, right? Let's make the right decisions when we're hiring people and put them into a compensation model that makes sense. So there are a few different ones that we like. Should we go into them?
Yep, let's take a deep dive. Yep.
Okay. So we like practices to start, I feel like a lot of practices like to start their new employees, and I'm talking providers here, right? Yep. So providers on maybe a 90-day, you're just going to get your hourly rate. Let's work together for 90 days, make sure we like each other, make sure I like your work, make sure you're trained up on everything. And then after 90 days, you might be eligible for some sort of bonus plan. So this, everyone wants to pay some sort of bonus plan to their employees. If they have a desire to stay on an hourly rate, however, that's probably the best answer for you as the owner. And the reason is that as they generate more revenue, our payroll cost isn't also growing. Right? Does that make sense? If they're just hourly or salary, then your profit on their production grows as they grow. But you're not going to find many providers who want to work on just a flat salary, and that's okay. So the second way that we typically see folks being paid is that flat salary plus some sort of a bonus based on some sort of KPI, right? And in order to stay compliant, always check with your attorney on these things because they can be tricky. The more KPIs, the better. So, it's best if it's not just a straight percentage of production, but ultimately, production is, in a lot of cases, what is driving the bonus amount, right? So what we like to do is say, everyone's going to get their hourly rate. And once you reach a floor, you're eligible for a bonus. Right. And you and I have talked about this. The floor is a certain level of production that we know we're making adequate money off of them. So providers, we like that to be 5 times their salary. So if someone's being paid $50 an hour, then we would like them to generate about $250 an hour, right? Before they're eligible for a bonus.
Okay.
And the reason is because, we got to pay them, right? If they're bringing in $250, we got to pay them, right? And we also pay for the supplies. We got to pay for the support team. We got to pay for the rent. There's a lot of costs in this thing. So they can't be breaking even, right? We need them to generate more. Okay. So then once they are at that benchmark, the 5 times, then we're able to put together some sort of a bonus model so that additional production, they can get additional pay for that. But overall, any way you slice it, we'd like a provider to be paid no more than 20% of their production.
Okay.
So it's important to keep an eye on. This is another thing back to the KPIs, right? We have to know what everyone's producing every month compared to what they're being paid so that we can see, is somebody out of alignment? What do we need to do? Do we need to get them busier? Do they need more training? What do they need so that we can get them to 20%?
So basically, let's just say if they're 5 times their salary is like $250 an hour, and then that's their level to where they can get compensated. And then you can say anything above that, they get 20% of that?
As much as, yeah. If you could do less, like 10% of or 15% of, that gives you room to grow. So maybe we start at 10% and then we can grow to 15 or 20% beyond that as they've been with you for longer or as they're taking on more responsibilities, but no more than 20%.
Okay.
So this is hard. I mean, we sat in a room and given a talk before and someone raised their hand and said, hey, I'm paying my providers 35% of production. Is that a problem? It's probably a problem, right? Because then you're paying the supplies, you're paying the overhead, and no wonder she feels like she's not making enough money, right? And that's a hard conversation to have, to say, hi, I'm paying you 35%, we need to back down on that.
Right.
So you've really got to work it into a conversation around also giving them more opportunities to, maybe you give them training, maybe they weren't trained on filler before, but you get them really trained and really good at it.
Right.
So that they can increase their production, so that maybe their total compensation, even though you've changed the plan, their total compensation doesn't overall come down. Because we don't want to run people off either, right? Our team is so important. We don't want to run people off, but we can't go broke.
Right. No, I agree. And this is for all providers, nurses, nurse practitioners.
We think of this more in the med spa realm. So like an injector.
Right.
Now, if you have someone that like a PA or a nurse practitioner that's helping you and they're not necessarily generating their own revenue because they're more helping the physician, maybe in a surgery practice, we might look at that differently. So what we might do for all practices, regardless of what everyone's doing or, what your specialty is
right.
Make sure that overall is your payroll an appropriate percentage. So for a medical spa, we like that to be 35% or less. Sometimes it creeps into the 40, but definitely 35% or less for everybody, right? Because remember, you've got some admin staff in there, your office manager. It's more than just the providers.
Right.
And then for a surgery practice, it really depends. We see quite a range. Some of the best practices are around 15 to 17%. Some others can still get up to the 35 to 40% range. Hopefully not quite that high. And we're looking at non-doctor compensation. So we're not including the doctors in that payroll number.
Okay. That makes sense.
Just the staff.
That makes sense. So what are some of the pushbacks you get with this compensation model?
Yeah, well, people don't want to change, right? We don't want them to be paid less, so we really have to make sure that we're careful about not paying people less. I would say another thing to think about is that it needs to be pretty simple. Sometimes people want to put together these fancy things and It's so complicated that it's not motivating because we don't even know what it is anymore.
Right.
So we got to keep it simple. And then we see other ways to get the whole team involved in, making sure that the revenue goals are reached or the profitability or whatever is you're working on. Like if you guys were like, hey, our rebooking is terrible, we're going to focus on that. And if we can get our rebooking percentage to 80%, the whole office is going to share in, some sort of a flat dollar bonus.
That's neat. So that's in addition to, so it'd be kind of like a team. So that's the team member encouragement, right?
Yeah. So maybe a whole office bonus based on some sort of initiative that will improve the profitability of your practice. We're recently working with one where we said, every issue that we're talking about in your business right now is around needing to grow. We need, reactivations, we need our rebookings higher, and we need more new patients. We need to grow the patient base of your practice. So what can we do even at every level? From the receptionist to the providers to the MAs. What can everybody do to participate in getting more clients in the door? And let's reward that, right? So let's get everybody aligned to that one objective. That's not complicated. It's one thing, right? And then celebrate when we do well with that.
That's great. Yeah. And always make them feel like they're part of the team and it's a team effort.
Culture is going to be so important. Culture wins everything, truly. Like we work really hard at it in our business. And if you have the best culture, you're less likely for people to leave for reasons like compensation. Oh, the guy next door can pay me more. Well, you got to make it to where your team doesn't want to leave you for that. So be having those reviews, be having those one-on-ones, be having those conversations.
Yep. No, I agree. I mean, most of my teams are with me for well over a decade and sometimes longer. And it's a team effort. It's being open, being transparent, and keeping it simple. I think those are all very, very prudent things. So for the viewer or for the spa or the owner, what are like 3 take-homes? And obviously they're going to call you, but what are 3 take-home messages on compensation? It sounds like, know what they are, don't pay them too much, and then go back to your key practice indicators, right? I mean, yeah.
Yeah, I would say make sure you know, first of all, what your payroll is in total as a percentage of revenue. Is that in line with what we had talked about? Is it less than 35%? Is it too high or is it too low, right? If it's in great shape, then you probably just move on to the next problem, right?
Right.
If it's in bad shape, let's dig in more. So to dig in more, maybe we look at every provider and look at their production for all of 2024. What did they produce in 2024 compared to what did you pay them in 2024?
Right.
Or what did they produce first quarter 2025? What did you pay them first quarter 2025? Was that in alignment with our 5 times goal? So check that out. And then if you find that someone's really out of alignment, you're probably going to need some help designing a compensation model and fixing that.
Great. And we know who to call. So Jessica, thank you so much. It was amazing. I learn a lot every time I talk to you and meet with you. And this has been an amazing podcast. So tell us how people can reach you and so they can move forward.
Yeah. So we're at mavenfp.com. So Maven, like financial partners, mavenfp.com, and on Instagram at Maven Financial. And something also that we're offering is we're happy to do a complimentary profitability assessment. So if you want to know if your compensation is alignment with your peers, or if you're spending too much on consumables, or some of your costs are out of whack, we're happy to review that with you over the phone, over a Zoom call.
Great. Wise words from an amazing woman and an amazing firm. So Jessica, thank you again so much. Please give us your comments and thoughts and future topics. So until next time, stay wise and stay informed, helping you become a better you.